Hi, I'm Dr. Jason Dulac coming to you from my office in Springfield, Virginia. We get a lot of questions from patients about what are all-on-4 dental implants. So today I hope to answer some of the most common questions about all-on-4 dental implants to see if they're right for you. What are all-on-4 dental implants? All-on-4 dental implants are replacing all of your remaining teeth if they're in not a good condition, or replacing dentures. So you either have lost all your teeth or your teeth are in a position that they're no longer sustainable, and you want to replace those teeth with something better than a denture. Perhaps you have an existing denture, perhaps you have what we call terminal dentition, and just the teeth aren't in a good enough shape to restore them any longer, or you're not interested in restoring them any longer. So we take out all the remaining teeth if they're not already gone, and we replace those with 4 to 6 implants. That's commonly called all-on-4. Some people call it all-on-X. So 4, 5, or 6 implants in the upper and lower arch to replace all the teeth. Critical that you do it all in one step. It's really important that the bite be balanced when you do this treatment. It's a great outcome for a lot of patients who want to do something better than traditional dentures to restore their teeth. What are the pros and cons on all-on-4? The only con on them, honestly, is the cost. It is an expensive treatment modality. You're looking at $20,000 to $30,000 per arch, so $40,000 to $60,000 for the whole mouth, upper and lower. So most of our patients finance this. But other than that, it's all benefits. So it's going to be much better than a traditional denture. It's going to look better than a traditional denture. It's not going to come in and out of your mouth. You're going to brush it. It's going to restore the confidence of having teeth again. And, in a social setting, you won't have to worry about your dentures coming out at all. If you have a partner, you will feel like they're your natural teeth again because you're going to brush these. You don't floss them because they're all one piece, but you do want to water pick underneath there. And we go over all of that in the consultation. So if you're at all interested in this treatment to improve your dental health and restore some confidence in your life, then definitely let us know. We can set up a consult to go over everything in detail. Who is a good candidate for all-on-4 dental implants? Anyone missing all of their teeth and currently in dentures, or anyone in what we call a terminal dentition, which is you don't have enough remaining teeth to adequately restore or maintain those anymore, or if you're not interested in maintaining your current teeth anymore. Those would all be indications for all-on-4 dental treatment. When would somebody not be a good candidate for all-on-4 dental treatment? There are very few exceptions to being a candidate for dental implants. One of the biggest risk factors is actually diabetes. So my diabetic patients, I always have a discussion with them about maintaining their sugar in a good range. But if you were short of diabetes, there aren't too many other considerations or contraindications to all-on-4 dental treatment. What are the steps involved on all-on-4 dental treatment? Well, one, come in for a consult so we can answer all your questions, make sure it's right for you. There's going to be some diagnostic steps. And then typically the surgery is all one day. So you come in one day, remove the remaining teeth or place all the implants, and you'll leave that day with a temporary denture into the implants. And we want to let that set in for 3 to 6 months, let all the implants heal, and then we'll go back and replace it with a permanent prosthesis, typically a porcelain one. But you're going to leave that day with teeth, and that won't be your final, and you'll get your final in a couple months down the road. What anesthesia options are available for all-on-4 dental implants? It is a big procedure. I do recommend anesthesia or sedation for the procedure. We can either bring in a dental anesthesiologist or we can coordinate with an oral surgeon who does dental anesthesia. You don't have to undergo anesthesia, but I do recommend it. We do have laughing gas at our office. We do have laughing gas at our office as an alternative if you're not interested in being sedated or you're not medically a candidate for sedation. But most of the patients prefer to be sedated due to the large nature of the procedure. And you'll come in, you'll go to sleep, and when you wake up, you'll have teeth. How long does it take to heal from all-on-4 dental implant procedure? Well, there's going to be initial healing from the surgery the first couple weeks after, and then it's going to take 3 to 6 months for all the implants to what we call integrate, for the bone to grow into the implants or for them to be stable. So the first couple weeks after, going to be like any other dental surgery. And then the bone healing, you won't be as aware of as much. You do want to stay to a little bit of a softer diet, take it easier on the implants, focus on the home care. These things are important post-surgery, but it's a very safe, very effective procedure that has a very high success rate. How long do all-on-4 dental implants last? The goal of this is they're permanent. They can't get cavities. They can get gum disease. Occasionally implants do fail. But if you're coming in for regular maintenance and you're cleaning them, I recommend cleaning under them with a water pick. The failure rate is very low. So the hope is to maintain these for the rest of your life. Now, on occasion, people can get chipping or wear of the porcelain. It can then be replaced with a new prosthesis, but the hope is that the implants last you the rest of your life. What is the cost for all-on-4 dental implants? The cost is really, in my opinion, the only thing that prohibits more patients from doing this procedure. You are looking at $20,000 to $30,000 per arch, times 2 arches typically for most patients. So you're looking at around $40,000 to $60,000 in the Northern Virginia area. We do have a lot of financing options available for our patients, and it really is a great treatment modality. If you were to take the cost and reduce it by the number of meals you eat or the number of times per day you use it, I would say your teeth are one of the things you use the most in your day, maybe short of your iPhone. Will insurance help cover the cost of all-on-4 dental implant procedure? Yes, absolutely. If you have dental insurance, we'll make sure you utilize it to the fullest extent it allows. Most insurances cover some of the extractions if you need teeth removed. Most of them now cover some implants. There are some restrictions in that for some policies, but most do. And most of them cover part of a denture or hybrid denture. So definitely, if you have insurance, we will utilize the maximum amount of that benefit for you. How can you schedule an appointment to get a consult for an all-on-4 dental implant procedure and see if it's right for you? Very easily, just give the office a call. This is something we do consults for routinely on a regular basis. It's a procedure I do a lot. And if you're interested in learning more, please give our office a call, 703-451-4500.